me. Tamara's not here, but I think technically, I don't know where she is at the moment. Hi, Krishna. So we do not have this web enabled for today, but it is being recorded. So if you follow up and want to look at it or share it with the team, Tamara can make that available to you. I think she just sends out a link. We have some food and water over here, and in honor of Chinese New Year, we brought in authentic Chinese food from Panda Express. And actually, it's funny. I said to Tamara this morning, she said she was getting Panda Express. I said, "Oh, that's great. That's for Chinese New Year." And she goes, "It's Chinese New Year today." So it's a happy coincidence. So the way I'd like to start is to quickly go around the room. If you could just say who you are and what team you're representing. Kathy has gone through at least the titles and some of the information on the projects, and it might help her to just connect the face to the project. We're going to be talking specifically about some of your market slides. So Bo, can we start with you and just quickly what your project is?
Yeah, my name is Movn from Surgery Department. Our project is injectable gel graft for tendon repair.
I'm Kigo, I see the microbiology department. My project is combination therapy for chemotherapy and immunotherapy for liver cancer. Elias Caro from the Coulter Foundation.
Special guest today?
I'm Becky from one of the companies, and we are working on localized drug delivery using a thermal responsive pump.
Great.
And we are the same.
Yes, that's humane, right?
Yes.
Great.
Hi, I'm Yu. I'm coming from Biomedical Engineering Department. Our project is integrated frequency intravascular ultrasound and intravascular diagnostic imaging system.
So that's the one for the high-risk, low-risk class?
I'm Alex, I'm from Elsman's lab, and our project is a sensor integrated hydrocephalus shunt for imaging shunt failure.
I'm Nestor and Ispayan. We're both from Biomedical Engineering. Ultrasound Transducers Laboratory. We're working on a forward-looking iris for vessel navigation.
Going from Andy. I'm one of the Coulter interns.
And your projects are?
The forward-looking ultrasound, the dual ultrasound,
Okay.
as well as cystic fibrosis,
Right.
and the breast cancer diagnosis.
Okay, great. Danielle?
I'm Danielle Salinas. I'm from CHLA, and I'm working on cystic fibrosis and a new test to confirm the diagnosis after a positive newborn screening.
I'm Xin Huang from CHLA too. I work on diagnosis of TBI, covering brain injury.
Okay, thank you. Daniel?
Daniel Parker, also one of the Coulter interns. Working on a couple different projects. Dr. Schoen's image-based assay of tumor cells, the automated reach training system with Dr. Schweingoffer, Dr. Mashida's personalized cancer immunotherapy, and the Bell's palsy with Dr. Mayan.
Hi, my name is Garima Chaudhary. I'm one of the Coulter interns. I'm working with Dr. Huang and Dr. Huang's project, and also in Dr. Kemani's project, Optimal Ventilator Management, and Dr. Yamishoro's GERD.
Great. Okay.
I'm Francisco Gutierrez from the Scott Fraser's Translational Imaging Center. Our project is intrasurgical augmented reality using a spectral phaser. That's it.
Andrea?
I'm Andrea. I'm a Coulter intern, and my two projects are Movn, the cardiac rehabilitation app, and Chromecast automation with Krishna.
I'm David Tannen. I'm also one of the Coulter interns, and my three projects are the hyperspectral phaser imaging, the improved vision for macular degeneration, and the third one is in my mind.
All right, well, think about it. Krishna?
Hi, I'm Krishna from Electrical Engineering. I'm a prior Coulter awardee, and I've enjoyed the training program in the past. I'm here with an idea from my dentist and I, a concept for a recent cone card artifact in dental x-ray.
I'm BJ Docker from the USC Center for Innovation.
Mark Littnell, Biomedical Engineering. Our project is to improve imagery for people with, or image quality for people with macular degeneration.
Now I remembered why Tamara is so important, because she has the agenda.
It doesn't matter because we're already.
All right, so I think Kathy is going to go through some slides and talk to you about how to do market analysis, and then talk about some examples, and it's going to be a very interactive session.
Yes.
So I'll just let you go.
Thank you. Thank you.
And Kathy Allen, I should say a little bit more, is from the Center for Technology Commercialization at the Marshall School of Business, and importantly is one of the oversight committee members on our culture program here at USC.
So you're talking about your market. This is the first one that's listening to you talking about it.
That's right. Yeah, I am a professor of entrepreneurship. I am an entrepreneur, a serial entrepreneur, and tech commercialization is my expertise, and my love, my passion, is the life sciences and medical. So this was a real sweet spot to be here. So I'm happy to be here. We are going to move fairly quickly, and that means that you're going to get, there's no way I can give you everything you possibly need to know when it comes to market research. But what I've done is pick what I think are some of the key things you can do that maybe you don't already know, your interns have done, and so maybe this will be very helpful to you. I'm starting from the premise that you have a compelling problem that you're solving, and that there is somebody who's experiencing that problem in a way that they're willing to get it solved by paying for it, okay? If they're not willing to do that, then it's kind of hard to talk about a market, okay? So that's the assumption. But I'm going to ask you, when we pull up some of these market research slides, I'm going to ask you to tell me what the problem is you're solving, and to tell me how you're going to solve it very briefly, so that then all the market data makes sense. All right, so when I look at market research, I really think we're talking about empathy. We're talking about a deep understanding of the customer. Now, in the case in medical devices and therapeutics and all of the things that you're dealing with in this room, our customer, the one who pays us, is probably not the one we're designing this all around, is it? It's the patient that we're thinking about. And our customer, the one who pays us, is some third-party provider or the patient directly, if it is that kind of a device. But most generally, we've got a pretty complex system of customers and stakeholders, which I know you talked about in your last session. So I'm assuming that you have done a good job of identifying stakeholders. However, I'm going to show you something in a minute about the way I kind of looked at it. So deep understanding of the customer has more than one pain point generally. It's rare that you identify a pain and it's just a single pain. It usually has a lot of situations associated with it. The customer has a journey relative to the problem they're experiencing, and so there are many pain points along that journey. All of those pain points turn out to be opportunities for you. They're opportunities to solve the problem. I'm assuming you've identified a compelling pain point, and what I mean by compelling is, I'll show you in just a second the kinds of problems and which ones are more compelling than others, but a compelling pain point is something that a customer is willing to pay for, okay? And today, that's a really critical factor, because a lot of things that we come up with, unless they're a 10x or more improvement on what's currently out there, nobody's going to pay for it. So, and I'm going to assume that you have a clear and focused problem statement that identifies your customer and your end user. Okay. So when I said there were many ways to look at the problem, I kind of laid it out so that you can kind of identify where your problem is. If we look at latent problems, those are problems where it's a real problem, but the customer doesn't know they have it. Okay? And so therefore, what does that mean for you? If you were trying to solve a problem where the customer doesn't know they have it, a solution looking for a problem. Is anybody there? Is anybody solving a problem where the customer doesn't know they have it? You are. Macular degeneration, the thing for TV, the USB? Oh, the image, okay.
Yeah.
Yeah,
That was just an idea.
okay.
Yeah. It's a little bit hard to say, but they obviously know they are visually impaired, but they may not be aware of the type of solution.
That's okay, that's okay. All we care about is that they know they have a problem. Okay, that's the important thing. So you passed that test. All right. The reason I put solution looking for a problem here is because I think without exception, everyone here started with a technology, and you had to figure out who had that problem. Okay, that is pretty typical when we're talking about university research. So we're not going to, you don't get dinged for that, but you have to go beyond that. You have to act as though you don't have a solution yet to really understand the problem. So the second kind of problem is passive, where the customer knows, they know the problem, but they're not motivated to solve it. In other words, yeah, it's a pain, but I can get along fine. There's nothing I need to do or pay for to solve this. Okay, so that's usually the kind of customer that may do workarounds or things like that so that they live a decent life, but they're not motivated to really solve it. The urgent one is where they're experiencing and actually seeking a solution. In fact, you may have cases where patients or other people that you've identified as your end users are actually trying to solve the problem themselves, where they can't get help from their healthcare provider or whatever. They're trying to figure out solutions themselves. This is the kind of customer that is sort of the sweet spot of where you want to be. Because if you can give them a solution that exactly matches the pain that they're suffering, they're willing to pay for it, and usually they're willing to pay a premium for it. Okay? So beyond that, we have kind of the visionary problems. We're working on a solution, but we'll pay for a better one. This is something sort of what we call kind of over the horizon kinds of solutions. So things that are kind of out there where you have to create the market because the market doesn't currently exist. Okay? And we hope, I don't think anyone in here is in that position because you've all identified a market. Okay? So where we're going to try to position you in terms of your market research and your customer identification is in this category right here. Any questions about that? Yeah.
There are different opinions if one problem is passive or GERD, right?
Okay, go ahead. No, elaborate on that.
For example, some doctors think, certain device might be nice to have. Some doctors think it's really necessary for them.
Yes.
And
yes.
then, so what do we do? How do we categorize? Is it really passive or really GERD?
Well, if you have gone out to the market, if you have talked to physicians, and have you done that?
Yes.
Okay. And so, give me an estimate. How many physicians have you talked to?
13.
30.
13.
13. Of those 13, how many felt that this was an urgent problem that needed a solution like yours?
60%.
60%? Okay, that's not bad. Okay, what did the others say?
It's nice to have.
It's nice to have, but not a big deal. Okay. Do you think that 13 physicians, were they all in the same specialty?
Yeah.
So what specialty they were in?
Vascular
surgery. Okay, good. All right. Do you think maybe talking to more physicians, you might get a higher level of comfort about whether this is something that's really needed? Do you think 13 is enough?
No.
Did they all come from USC?
No.
Okay.
Different hospitals.
They're all different hospitals. Okay. Okay. What do you think, the rest of you? Is 13 enough?
No, it's not.
It's a little
No,
small.
it's not at all. I can give you evidence of someone who did not find the right customer until they had talked to 450 people. And when they got to the 451st person, that person was the one that actually defined for them where their market should be. Now, I'm not suggesting you will need to talk to 451 physicians, but what I'm saying is 13 is a pretty small sample. Because you could, what?
I was just gonna say, Andrea, Movn Analytics is in that incubator now. How many customers are they making them talk to? How many physicians?
At least 15 customers a day.
Yeah.
So they're in an incubator right now, and they've got them locked in a room with phones, and
There you
they're.
go. Yeah. Because you could do another 13 and you may get a flipped response. You may have 60% saying it's not, doesn't, you can't, don't rely on such a small sample, okay? Well, yes?
It sounds like you're not really going for a statistical sampling.
No.
Because probably after you've talked to 400 people, you do have a good statistical sampling of whether it's an interest, and it's 1 out of 400. It sounds like you only need 1, is what you're saying. Or, I mean, that
What do you mean you only need
well,
one?
what you're saying, there's a person who talks to 450 people and they have not given up. It's not that they have a bad sampling. It's that there's only 1 out of 400.
No, let me clarify that. It wasn't that 450 people said, no, they wouldn't buy the product. This happened to be laser mapping technology. So it wasn't about would they buy the product, it was about he hadn't identified the right customer. He was interviewing the wrong people. And so when he got to that one that set him on the right path, he didn't stop there. He went out and he interviewed enough people to assure himself that this was the correct, and it was. And he launched the business and he's very successful. So the key is not, don't focus on 450, although your incubator people probably will end up with numbers like that. The key to focus on is this is an ongoing process. You cannot get the answers anywhere from except by getting out in the field with customers and talking to them and really listening. Because, and when I say really listening, I mean listening without preconceived notions and bias. Okay? Really listening to what their pain is. And then coming back and saying, does our solution solve that pain? Is that pain so great and our solution such a good match that it makes sense for us to move forward?
Can I make a comment?
Yes.
So something that is also important is when you are an engineer, it would be good to go and see the clinicians performing whatever procedure we're using your instrument or device is going to be used to really understand the procedure. Because just talking without really having a depth knowledge of the procedure, you won't be able to ask the right questions.
Yeah, that's a good point. Yes.
When do you, so this takes time, so when should you do this talking? Should you do this before the product, after the product, both? How do you distribute the time?
My opinion is, and my experience, and I've had one company that did develop a medical device, you need to get out long before you've ever designed the product. That would be the ideal. You uncover the need, you go out, understand the pain deeply, and then you go back and your engineers can think about how can we solve this problem. But until you do that, you're making assumptions you have no right to make. Okay? So I would say ideally it's before you develop it. But at universities, research, we get funded grants, we go along and all of a sudden we realize, oh, we've got something that has a market. That's okay. You can do it. You can still do it. But you have to be ready to find out that your technology either has so small a market that you can't afford to do it, or it has no market at all. Now on the happy side, you could find the perfect market. but you have to go at this as if you didn't have that technology in hand. So when I agree with Elias that when you go out and not just interviewing, I'm a huge proponent, but I wasn't asked to teach all the ethnographic market research stuff that I do. I'm a huge believer in observation. I'm a believer in embedding yourself in the situation and observing. And in your case, the macular degeneration, I've been in surgery standing next to Dr. Humayun several years ago, watching him do this for something I was working on with the Retina Institute, and that was several years ago. But what did I learned so much watching that as a business person about what it took, you know, and what tools he needed and and he was testing a prototype when he was doing that.
And just we have a diverse group of clinical applications for the projects here. And one little thing, and just because I'm a little bit familiar with some vascular surgeons, is that there's different technology adoption profiles by different clinical specialties. Right? So some clinicians, like interventional radiologists or cardiologists, very comfortable with having new products and new technology solutions always in their practice. There's a whole spectrum of that leads to a longer tail, so people that actually don't see much innovation. They don't see a lot of new devices. So, you know, and your group is, are they currently using any imaging technology? Is the idea of imaging just so foreign to them that that's why they're away from it? Or they use it and I don't think there's much value. So there's a different other sub-element there. There definitely are different experience in technology adoption or complexity adoption factors in different clinical specialties.
And also this, you know, this project is your baby, and you have a lot of time and effort invested in it. So you have to understand when you go out and talk to people, you have a natural bias that is going to have you thinking, your mental model is going to be saying, how do I get this guy to agree with me, that, you know, instead of really hearing what he's saying. You have to go out and try to, I'm a firm believer, when you come up with an idea for something like this, you go out and try to kill it first. You do not go out and look for confirmatory data until you first look for things that will blow it up. And that saves you a lot of grief down the road. But let me move on just a little bit because we'll be able to, I just want to briefly remind you, because I know I saw some of you use total addressable market. I actually call it total available market because you may not address it at all. I mean, and you certainly won't address the entire market. But a lot of us use total available. It makes no difference. We're still talking about the total market. So as a very simple example, all graduate students would be an example of a big market. SAM, you know what that is? Anybody? Don't whisper, just say it. Service available market. So that's your segment of the total market. So say your segment is all engineering graduate students doing research. Okay? And then there's the SOM. Anybody know what the O is? We know what the S is. Yeah? Obtainable market. This is a market you can realistically reach. So grad engineering students at USC. Okay? Usually this market is geographically based. First customers are another category from the obtainable market. They are the first 10, 20, 30 people who are going to actually pay for your solution. Okay? So they're the early adopters. Okay? Is that clear? All right. Good. All right. So guess what? So Movn is sitting up here on the board, and I know we have the intern here. I got 2 or 3 of these up, 3 or 4 of these up here, and I wanted to ask you. I looked at this. First of all, give me your problem statement. What problem are you solving?
Increased compliance to cardiac rehabilitation.
What problem is that?
Low compliance. Low compliance.
Okay, so, but if you want to solve a problem, You need to frame the problem so that it suggests that there is a solution. Okay, so one of the tricks you can use to frame your problem is to start it with a little stem that says, how can we? Or wouldn't it be nice too? But I kind of like how can we because it's simple. So how can we reframe your problem?
How can we improve compliance?
Don't cheat. That's a struggle. How can we?
Improve compliance to cardiac rehabilitation.
Okay, all right, so we understand from that statement that the problem is lack of compliance, and so it suggests that that's where we're going to focus our solution effort, okay? The way you said it before was sort of a statement of opinion, maybe fact, but it wasn't a problem statement. So when you frame the problem, think about saying, how can we? Frame it as a question and be very specific about the problem that you're trying to solve. Okay, so moving. We have 1,228 cardiac rehabilitation centers with potential to serve 2 million patients. Where is this? In California, in the United States? In the United States. Okay, so when you say the potential to serve 2 million eligible patients, what are they eligible for?
For available cardiac rehabilitation. They're based on their diagnosis.
You mean I could compete to be eligible for cardiac
No,
rehabilitation?
based on Medicare, what Medicare will pay for, based on insurance.
Okay, so Medicare eligible. Okay, so be very specific when you state things like this, so that when people like me read it, we understand. All right, so you're saying with a potential to serve 2 million Medicare eligible patients. Is that all Medicare eligible patients, 2 million of any kind? What's the characteristic of these patients? It must be specific.
They have either undergone a specific procedure or they have a specific diagnosis.
What is the specific procedure?
They're the ones that are in the little.
Okay, so all right, so they have to have undergone one of those procedures. Okay. Now you said the unit cost is $720 dollars a patient per year. How did you arrive at that number?
So that was based on having. So this is going to be an application on your phone, and there's a reimbursement scheme for $100.
Wait a minute, hold it, back up.
Sorry.
I forgot to ask you one other question after you framed your problem. Give me your solution statement. What's your value proposition?
So the solution is to lower the barriers to cardiac rehabilitation, because one of the main reasons that people don't attend cardiac rehabilitation is because they can't get to it. It's not convenient. They're having to go to the hospital to maintain that.
Gotcha.
And so this is a mobile application where they are checking their activity and keeping up with the rehabilitation remotely, and then able to call in and have a conversation with a nurse once a week to check in further, and then they have fewer appointments.
Okay, that's a really long description of this solution. Okay, so when you give your solution statement, let me give you 2 other kindergarten words to help make it really simple and quick. We make and sell, we develop and ship, we, pick verbs, action verbs that describe what you do in your solution. So, as I'm hearing it, if I'm one of these patients that's non-compliant, I'm going to look at my phone because I'm really compliant with my phone, right? And then I'm going to look, and you're going to tell me it's time to call the doctor's office.
Yeah, that's one of the things. And then
And they're going to be able to do everything remotely?
other than they'll still have to go to the doctor's office, but very few times compared
Okay.
to 3
All right.
times a week, and then it goes to like
You
once per
told
month.
me you were going to solve the problem of compliance. What's the biggest problem of compliance?
It's being able to get to the.
Physically going from my house to the doctor. Okay? So I won't ask you to solve that right now, but that's what you promised. Okay? So think about that. Is that really the problem you're solving?
You're having them go to the doctor much less.
Okay, but you didn't promise that. Okay, because then if you say much less, how much is much less? Okay, I'm trying to get you to be specific because it matters. Because if you get out there in the market and you don't have a connection between the need and what you're offering them, you're going to stumble when you try to make money. Okay, and I don't want you to stumble. I want you to be a success. Okay, I'm going to skip to the next one. Okay, are they here? You're here? The GERD people?
Garima is here.
GERD
representing.
representative is here. Okay, so the addressable market is patients suffering from GERD, and GERD affects 7 million people, 20% of them now. This bothered me because the last time the census was done, we're over 300 million people in the United States. 20% of that is like 21 million people. Okay, so this is a good lesson. I'm glad you get to be the guinea pig. If you put up a slide like this and you're trying to pitch this for money from anybody, and your details are off by multiple millions, you know, we start to question, okay? But do you understand what I'm saying? Do you really mean to say the whole U.S. population?
I think I should have been more specific in terms of like the GERD the people suffering with GERD, and
So 7 million people suffer from GERD at any point in time.
in their entire life, not in like any point in time.
So, but don't we have, I mean, people grow old and die and new
Yeah.
people come along. Do we have a constant level of 7 million people at any point in time that are experiencing GERD?
Yeah, that's
Okay, so the constant is 7 million. Okay, so it's much less than 20% of the population.
Could be 20% of their lifetimes.
You mean over 20% of their lifetime?
No, I mean, it's possible that what it could mean is that, you might only experience this for 3 days.
Well, that's why I was trying to find out. It was, but she's actually saying 20% of the population. So, no, that doesn't. Okay, so that needs to be looked at because we want to know it's a compelling problem, right? Because that's when people will pay for it. All right, so the initial target market is GERD patients incurable by proton pump inhibitor or antacids. How many people fall in that category?
I have that number.
You know, just rough. Is it a lot?
It's around around 45% of patients who
45% of this group. Oops. Well, that gave the clues to who's coming next. Okay. Of this group, 45% of this group.
Yeah, they have GERD, but the PPI or the antacids is not able to help them. So they would need this kind of, they would need the pacemaker. So that
Okay.
percentage, so 45%.
So the market that you're really going after initially, not first customers, but your market, your SOM, we don't know how big that is. So, okay.
That's 40 to 45% of the 7 million people.
Of the 7 million. Okay. And then how'd you come up with your unit cost?
Okay, that was, there's a company called Cyberonics, and the calculations were based on, Cyberonics makes these pacemakers for epilepsy, but our pacemaker would be very similar in terms of the
Okay,
characteristics.
so you got a
Yeah.
pretty good ballpark. Not good enough for, down the road, but good enough for now. Okay. So that's how you, now, I question this number because of the things we talked about here, so you would have to go back. Now, I didn't ask you, give me your problem statement. How can we you're not going for the cure, right? This is sort of to, becomes a chronic illness.
Management of the problem.
Yes. By the way, I spoke 2 weeks ago over at gerontology to the assisted living industry, of CEOs of all the big assisted living facilities. And in doing my research to do that, I discovered 45% of our population today has a chronic illness, and that it's increasing annually, the number of people with chronic illnesses, which is going to hit that assisted living big time down the road. So this is a chronic illness. How can we, what are you trying to accomplish? All of you should be writing your how can we statement. because you need to be able to frame this problem. If you don't know what you're solving, how do you solve it? Okay? I'm not going to write your statement. Okay? All right. Let's go here quickly. Art. 80% of the 800,000 that suffer from new or recurrent stroke each year involve acute, I won't pronounce it, but it's paralysis of the upper limb. Is that where it falls out of the socket? Okay. Consumer pays $80 a session for your solution. Where are the people for art? Yay! What's your...
So the consumer pays $80.
No, what is your problem?
Our problem is how can we improve the efficacy and efficiency of the rehabilitation of arm and hand function after stroke at a low cost.
You just want to prove it? You don't want
Improve
to
it.
actually
Improve it, sorry.
Okay, how can we improve?
The efficacy, the efficiency of rehabilitation of arm and hand function after stroke at a low cost.
At a low cost, okay. So that says, that to me sounds like the problem you're trying to solve for your research lab, as opposed to for the patient. Okay? What is the patient interested in getting solved?
Can we improve arm and hand function?
Be able to use their arm and hand normally. Okay. So you're really not proving efficacy. You're trying to improve the well-being of the patient, be able to use their arm.
Mm-hmm.
So word it in that way so we know that it's the patient you're solving the problem for, not your lab. Okay? All right, good. And then, all right, so still I'm looking at some of the numbers on some of your things I just will briefly mention. They're small numbers. Now, I'm assuming that this might be, this is not the market size.
It's based on 10% penetration of the market.
Which 10%, I know you were told to use that. And can I tell you, because Christina's already heard this from me, don't ever stand up and make a presentation and say, we are going to capture 10% of the market, because you will be laughed off the stage. And that is because, how do you know? Why isn't it 9%? Why isn't it 11%? How are you even going to get 1%? So we want to know, bottom up, how are you going to do this? Okay? So your initial market, your first customers, you can show that, and then you can show your initial market, how big is that? What are you going to do to capture that? So please do not start at the top and say, let's assume we're going to capture 10% of the market. For our purposes here, it's fine because you were told to do that.
Are you laughing because it's too small or too large or too non-specific?
9.6 million is a very small market.
I'm talking about, if you say 10%, I'm going to capture 10% of the market and everybody's laughing. If you said I'm going to capture 90% of the market, would they laugh harder or would they laugh less
Well,
hard?
of course they would. Of course they would. The only way you win is if you identify a need in the market that no one is serving, you found a niche market, it's a complete market, and you can own 100% of it. That's the only way you can do that. Otherwise, every market you're going into has competitors, a lot of big-time competitors. So there's no assumption that can be made about how much you will gain. There is a path to saying, you know, this is what we're going to do to make these amount of sales over this amount of time.
So you should just never give any number for the fraction of the market that you're gonna capture.
No, you should. I don't think you should, because I think it's false. I think it's false. Now, the question, but what comes down to is, as part of your market research, you're looking at the competitive landscape, aren't you? And the competitive landscape is telling you who has the resources to wipe you out, who has the resources to buy you, who has, and you're learning about potentially how many customers you could grab. If you position yourself correctly in the market, my whole schedule has gone out the window. But that's all right. That's okay. If you position yourself correctly in the market, you position yourself to go in where there are no major competitors that you're going to have to fight. Okay? Because you don't want to go head to head with a major competitor. Assuming you are actually going to commercialize and go into the market yourself. Now, in some cases, some of you will be, your plan is to get acquired early by a large company that's going to develop on what you've done and take it off. But for those who are actually heading to the market, the commercial market, you want to make sure you've identified a niche that you can play in with kind of a bunker mentality, play in for a little bit and get some, establish some turf before other people start competing. Okay? Many of you have patents which allow you to do that in some regard. But disabuse yourself really early of your patent as a huge competitive advantage. It's only one part of a big issue. Okay? The good part, but yeah.
So, just so I understand, so you don't believe in trying to, even though these are somewhat arbitrary, trying to put together some realistic forecast to what you can expect to capture in the market versus, so you just want to give out like what's potentially out there, and then.
Well, aren't you telling me how big that market is based on your research? Aren't you telling me that in that market there are these players, and if they're public companies, you can find out what their market share is? So if these public companies are holding 80% of the market, and you're trying to go into that same market, we already know the most you could possibly capture is 20%. And you never capture usually the whole thing. So, I'm not alone in this feeling, but I feel really strongly. I'm sorry to say this because some of you are MBAs. It's the MBA mode of running market analysis. Let's assume that we're going to capture 5%, and with only 5%, we've got this multi-billion-dollar market. But you never proved to me how you're even going to get 5% of the market. Okay? If you can prove to me you can get it, that's another thing. So you can say 10% as long as I can be convinced that you can do that.
So I guess the takeaway from that as teams though is it should be like total market size, number of competitors. It's kind of like the high level version. It's a competitive market, people are in it. So either opportunities for exits or opportunity to enter it. There's a lot of people there, so fraction market.
That's right.
Or is it a monopoly, driven by one or two people?
Yeah.
It's a monopoly, so they have some proper context. So, because I know that's a lot of newness, but then it's a lot of detail that's beyond maybe the scope of the culture.
Yeah.
So it's appropriate.
Yeah.
Is your example of proof of being able to capture a 5 or 10% market, is that like to be deduced from your stakeholder analysis, or is that what would you see to say, okay, that person or that product can get 10% market share?
What would, say that last question again?
So you're saying you'll be left out if you don't have any proof like of 5% or 10% market share. What would constitute that proof to you? Like what should team present as proof that they will capture that market?
You will never be able to prove it in scientific proof, but what you can do is show, here is our pathway to commercialization. Here are the partners that we have already signed up. Here are, here are the customers that are on board. And if you can show a model where you can increase that customer base annually, we start to believe that you can achieve a certain market share within a certain period of time. You just have to show us how you're going to do it. Okay? That's all I'm saying. So when you look at the broader market, there are lots of things that you want to look at, but the bottom line is you want to understand how that market works. Okay? So that market is unique. Every one of you is in a different market, and it has different characteristics, and you need to understand that. Okay? All right. I wanted to mention this, my customer typology, because you have to be responsible for understanding the motivations of all of these characters, because in the healthcare field, they all play a role. And they may not all hold the check, but they all hold some kind of power over your success or failure. So it's really important that you understand the market you're dealing with, who you're selling to, who's actually making that decision. Okay? I made that mistake years ago with a doctor in neurology, with the company that we started when we first developed what's called the brain net for doing measuring EEG in trauma wards, so that anybody could take a reading and a neurologist anywhere in the world could read that result. And this was at a time back in early 2000s when this was not happening. But the mistake we initially made when we got started was we were going after physicians, emergency room physicians and neurologists and people to convince them that this was a good thing. And then when we discovered that the people we had to convince were the hospital administrators, the people who controlled the budget and the purchasing of this equipment at that time, we had to totally change the way we thought about our business model. And no, the doctors didn't go away. They still were the influencers and the people that we had to get on board. But they weren't going to be the ones who actually paid us in that scenario. So you have all these. Are you all familiar with these now? So this is not new to you, right? Or if it is, it's easily understood. All right, we're getting to the part that I think is really, really important. You've all written your problem statement, right? And have you written the solution statement?
Also the needs statement.
Okay, give me what you wrote, and give me what you wrote.
The needs statement?
Mm-hmm.
It was to provide a visual aid to A&D patients that measurably improves both visual task performance and quality of visual experience.
Okay, and is there any way anybody would suggest that was very well done? How could he improve it? Say it once again.
To provide a visual aid to A&D patients that measurably improves both visual task performance and quality of visual experience.
Okay. Any of these?
Make it shorter. I don't know.
No, it's fine. It's pretty good. But
Specify what the visual aid is.
thank you. Yeah. So is there a way to describe that
Well, we were
visually?
told specifically not to do that. I remember, like,
Yes, right, so
Because
the
there's
facility
a
is
solution.
leave it to
Three.
you.
Yeah, that was sort of the instructions when we were.
Okay.
So the workshop leader last time was Andrew DeMayo, and he has them develop a very concise needs statement, which doesn't have any solutions built into it,
Okay.
and just some maybe high-level specifications.
That's great.
And then, attaching the technology solution to it in the form of a value proposition.
That's good. That's okay.
So that was
That's
sort of the
okay.
method.
Yeah, but what he was saying was the unmet need. He was not talking about the solution.
Yes. He's only talking about the need.
Yeah, the unmet need. No, I'm okay. I was not aware of that. So that's fine. And actually, going back to what I said earlier, that's great, because you have completely forgotten your solution, and you're just talking about it in general terms. Okay, great. Thank you. All right. So where we're going to go now is to talk about one of the things that I think many people do poorly. And they do not spend enough time looking at how their market segments, how it splits up and in what manner. Now, what I have here on the board is a very simple, this is a really basic segmentation, and this was for actually a project out of USC. And I had, this is about 3 years ago, I had some students work on this. The docs who were involved in the development of this had one vision of who was going to buy it. When the students went out and did the research like you're doing, and then you discovered, hey, the people they thought were going to buy this just don't think it's what they need, they had to look for other markets for it. So what the segmentation matrix does is it allows you to identify who your customers are. You identify what the benefit is, the value proposition. That's what a value proposition is, a benefit to the customer. And benefits are not features. Benefits are things that improve. So benefits are health and love and losing weight and, you know, all sorts of things, but they're not features. And then the channel, how we were going to reach them, and who the primary competitor was, and this happened to be their company, the primary competitor in that space. So the purpose of a segmentation matrix is for you to compare, and if you look at this one, this is very simple, but if you think about it, you could make it much more complex, and you should. You should have a big spreadsheet that also includes the size of all of those markets. It also includes dynamics like other competitors, profitability, maturity of the products in that market already, those kinds of things. What's already being met in that market? You're coming in with your idea, what's already being met? And is there a willingness to pay? What's the adoption likelihood? Okay. If you can lay all that out, and you'll get a copy of these so you don't have to write all this down. Lay it out in a big matrix. And you can add other things depending on what market you're in. Add the key variables that are going to help you determine how you position yourself in the competitive landscape of the market that you're in. Okay? It's also going to help you determine which market do you go after first. There's a rule of thumb about which market you go after first. What is it? Anybody know?
Was it the biggest? I feel like
What?
that's a trick question. So I wasn't the biggest, but I feel like that's a trick question.
Everybody says the biggest, and yeah, it's a trick question. It may not be the biggest. The one you want to go after is the one where the customer is in the most pain. And that's because they'll buy quickly. They will adopt quickly because they have this huge need. So you have people who, with macular degeneration, not everybody with macular degeneration might pay for your device, right? So within that broad group of people, who's most likely to buy them? And you, only you would understand that because you're looking at the market and understanding the market, okay? And so your first customers, remember the 10, 20, 30 customers are the people who are in the most pain, okay? They will write the check immediately. In fact, they will buy it even without reimbursement if they're in that much pain.
This is tricky because the patient may be in pain, but the therapist or the doctor may not be.
It is tricky because remember, going back, your customer is not necessarily the one who is paying you, and you have to influence the doctor, okay? Which is what my students had to do too. They had to go out and find that group of docs that really believed in this and were forward thinking in these kinds of solutions. So it's a political thing, it's a persuasion game, but you have to find even within doctors, which is that segment that is going to be accept this and understand it. But it also goes back to how you present it. So what I want you to do right now for about 10 minutes or so, let's go back to the very, let me just say this briefly, but I'm not going to spend a lot of time on it, because I want you to do a little matrix. When customers make decisions, they make them on several levels. The deepest decisions are the ones that they ponder the most, and these are the ones that require the most persuasion if you're trying to sell them, because it's a fundamental change in the way they do things. The middle of the road spectrum is where a lot of things like whether to visit clinic about consumers, whether to visit a clinic about a medical condition, whether to switch one's brand of car, whether, those kinds of things. They're important decisions, but they're not life-threatening decisions. And then the shallowest decisions are these. And the decisions that customers make in this area are the ones you want to stay away from. Because those customers usually find substitutes, or they just don't care about solving it. So again, you're kind of in this space, is where some of you actually are down here, but you want to kind of be in that space. So, I forgot I had this one too. One last one to show you before you do your segmentation here. I love this little matrix, and we in business, we always use matrices, and I'll tell you a little secret if you don't already know it. The right answer is always there. No matter how you set up the matrix, it's always set up so the right answer is there. All right, so when we talk about products, we talk about them in terms of whether the solution we're offering is complete. It's an end-to-end solution, solves the problem all by itself. Or whether it's a feature. It has to be combined with something else to provide a complete solution. How many of you are working here? 1, 2. How many of you think you have complete solutions? You don't need anything else to solve the problem but what you have. What are the rest of you doing?
Well, I think they're very true, and you have stakeholders that determine, and we think that's, I know I'm listening to you say it, I know what you mean by someone, but I'm not raising my hand yet, because I could have a question. They have solutions, but they everything else.
Do you think you can completely solve the problem as you define it for Movn? Can you offer it as a complete solution to say, this is the problem we're going to solve, or this is all you need?
I think it depends on how you define the system itself.
Okay.
Because it's more like if you define it as an integrated system that also involves the already existing system.
Yeah.
But it's not, I don't know.
It's
like hard to say.
Okay, so I totally understand.
You want another time? How about Danielle? Do you want to talk about yours?
I think it depends on your product, how confident you are about the product you have. My perspective is from a clinician, and I think this is a very complex way to see this. Because the way we see as doctors making decisions and what tests to order or what product to use is how good the evidence is. I mean, now I'm on the other side, so it's kind of very confusing, but as a doctor.
I think good doctors make decisions that way, but not all doctors.
Unfortunately, it should be. In payers too, unfortunately, we have to go by what is the insurance willing to cover and so forth. But in terms of, I'm an academic, so what I would like is to chase the evidence and how good this new drug with this new test is in comparison to the existing drug or treatment or whatnot. So to me, it's very simple because you read the literature, you see the results of clinical trials, how big the sample size are, you go through the exercise of evidence-based, and that's it. And then there's a lot of situations where we can argue with insurance that this is the better route instead of what you have to offer for this patient. And we're fighting for patients constantly to get the best care based on what we believe is evidence-based. So
And your product is,
it's a new test to confirm positive
diagnostic?
newborn screening. Yes, diagnostic.
okay, so it's a diagnostic.
Yeah.
Okay. So you can call that a complete product if it doesn't, the diagnosis for what you define it to be.
If I'm confident about the technology, the idea that I'm coming from, yes, I think.
Well, of course. Anything like this, look at it this way. It's not going to exactly fit everything you are all doing, but I'm trying to get you to think about things maybe in a little bit different way. Okay? Because the worst thing you can do is get stuck on a path with blinders and never challenge your thinking about this. And so I'm trying to throw stuff at you that will get you to say, and some of it will stick and some of it will not. But I can tell you from years of experience as a private investor, as an entrepreneur, as someone who's gotten products to market and developed and patented, I can tell you that what I'm telling you, I've seen over and over again to be true. And you don't have to agree with it. I don't, that's fine. But we do have to look at who wants this, and for the most part, if you can strive toward providing a complete solution, you'll have a better chance at success, a bigger success with what you're doing. And I think you do have a complete solution.
So I have a specific question on that, because that was a lot what my focus on interviewing stakeholders was all about, right? So the gold standard test today that was developed in the 50s is good, but it's only good for a percentage of the newborn screenings, right? So we have all these different mutations, the screenings identify the mutations, and then the existing test is only good for, let's say, half of the population with positive screening. The other half is in limbo, it's a genetic limbo. Oh, we know about this gene, we don't know what it means, right? The new product is supposed to be just as good with the known mutations and also good for the other mutations that nowadays are left on limbo. So when I ask, well, should I start with the market of this, the equivocal diagnosis routine, or should I just go for the gold and just say that this will replace the gold standard? And all of them said, no, if the sensitivity and specificity of this test is good for all patients, all different types of mutations, there's no need to have two steps. Like you do this one test, but if it's equivocal, then you do this other test. But then you're saying, who would really be interested in paying for this? Those families who are in limbo. So that would be the most pain that you're defining. But now I'm unsure of what would be the best strategy.
Well, but you have, it's more complex than that in your case, because you also have to look at, you have clinical trials associated with this, don't you?
Yeah, validation.
Okay. And so if you're diagnosing for different groups of patients, it's likely you are going to have to do tests in all those different groups. And the question, and this is more of a regulatory clinical trials question than it is sort of a market research question. You have to make a decision. If we want to get this out into this first patient group first, and then we'll build on that and do the trials to get it to the other patients.
Yeah.
That's a typical process for anybody going to market with a product.
Yeah.
You go where you can go quickly and get some revenue coming in so that you can fund all the other markets you want to go to.
No, I agree with you. I was just
So I think-
surprised to hear from different, and I interviewed physicians in the HMO system, in the academics.
Well, you're hearing from me as a business person, and I don't know if you've been talking to mostly physicians, and that you will get a different view. Yeah.
Thank you.
Okay, and just very quickly, so the purpose of this chart is to say that across the things that you are all developing, the gold standard would be the cure. If we can find the cure for something, wow, we don't have to think about customers, we don't have to think about money, because it'll be there. But most of us are not doing the cure, okay? We're getting close, we're somewhere in this spectrum. Where you don't want to be is here. You're doing something that nobody cares about, candy, You can get it anywhere. And it's part of a solution, it's not the whole solution. So this is like the dead zone. Okay? And what you want to strive for is as complete a product as possible that gets as close to a cure as you can get for what you're doing. Okay? And you're not trying to cure, you're trying to diagnose. So as close to a really top-notch diagnostic test. Does that make sense? Okay. So think of this as a guide to see where you are in terms of product market fit. Because if you have to go for investment to build your business eventually, you need to think about this. Okay, so now here's what I want you to do, 10 minutes. I would like you in your group, if you would, just draw out, let's do just the simple basic segmentation matrix. And see if you can identify 3 customers that are appropriate for what you're doing. And the benefit to those customers, the channel, and the primary competitor in that market. Okay? 10 minutes? You should be able to do it because I think you have all the information. It's a matter of organizing.
Okay, so there's food and history on the corner and
So I was going around looking at what some of you are doing. You asked great questions, and you're putting together, the basic matrix. Remember, all of the things that I suggest as things you could do in your matrix, some of them are relevant now, some of them will be relevant further down the road. Okay? Like I just was asked about how much investment does it take to go into a particular market? That's something you may not need to be concerned about now, because right now you're probably concerned about getting a prototype and all of that. But down the road, as you start to look more in depth at other markets, you want to determine what's going to be the cost of going to that market. And where can we get where are investors going to be most interested in helping us move next? So that's a matter of understanding. You don't have to do all that now, okay? The other thing that came up as I walked around was you are in many of you are in the happy situation that you have a benefit that is going to benefit not only the patient, but also the physician. So it's a twofer. And if it's saving money for the hospital, you'll have a threefer. So the importance of that is that you'll get buy-in much more quickly if you can show a demonstrated benefit to the targets that you have. Okay, so the difference between what you're doing and a normal business is you have a lot more characters to account for. You have a lot more people in the pool with you. And you have to understand their needs, and you have to understand what they consider to be a benefit. So in general, hospitals today, number one thing, yes, they want to save lives. They have to reduce costs. Okay? They also have to reduce patient readmissions. So if you understand hospitals' pain, and there's a way for what you're doing that is benefiting the patient to also benefit the hospital, that's a win-win, and you'll have an easier time getting acceptance for what you're doing. Okay. Questions in general. Does anybody have one that they want to just give us a taste of what you came up with? Because I know
I saw some good ones.
I saw some good ones too. Be confident.
How about Nicholas?
Nicholas?
Should I?
Go, Nick, go.
Should I just read it?
Yeah, why don't you just kind of give us because I don't know if there's a quick and dirty way for him to hook up So yeah, why don't you do that?
And so I identified three type of customers.
Okay, remind everybody, but mostly me.
So this is for a device that improves arm function after stroke.
So your problem statement and your benefit or value proposition.
We go back to what I wrote.
This you have to, and down along the way you should commit this to memory, because someday somebody's going to say, oh, so what are you doing? And then you're going to say, oh, well, it's too complex to explain. But no, it's not. You
So
can
we
say
want
it
to-
very nicely.
How can we improve arm and hand function after stroke at a low cost?
Okay. And okay, for low cost, and your value proposition is?
To provide clinically validated, personalized e-rehabilitation solutions.
Okay, all right. Okay, good. So we have the space now in which you're considering your solution. Okay, good.
So the segmentation matrix, we define three customers: the patients themselves, the therapist, and the hospitals.
Okay.
So notice that the therapist can work either in a private clinic or in a hospital.
Okay.
So the patients, they can use their arm in daily life, that's the pain. Benefit, we will improve the arm function, and
Now, say that as a benefit. Improve the arm function is you doing it. What's the benefit to the patient?
the greater use of the arm in daily life.
Yeah, when you state a benefit, I want to encourage you to stand in the customer's shoes and view it that way.
So we have an issue if it's class 1 or class 2 device. We think there's a possibility of making it a class 1 device. So the class 1 device we can do direct sales to the patient. There's one other company that has actually class 1 device similar to ours, for hand, just for hand, and they sell on the internet. So that would be the first line. The second line is selling to small clinics, and the pain is that they don't have the time to treat patients because it takes a lot of time and it requires a one-to-one interaction with the patient. So with a device, they could have several devices and supervising treatment of several patients at a
Okay,
time.
so in that case, if you were going after that market, whenever you say you're going to save the physician time, you know that that is a piece of evidence you're going to have to provide. How much time can you save the physician? That'll be the first question they ask. So in your research, see if you can figure out. Now, you won't get a true measure of how much time until you actually get things in a prototype and you can actually test it in the field and get some measurements. But you could estimate, okay? Just so we know, because what's the gold standard if you're talking about improving time, saving time? It has to be a significant amount, or people want to pay attention to it. Okay.
Okay, so the benefit to the therapist is greater satisfaction with of the patient and increased number of visits.
So the therapist is going to get a warm and fuzzy because the patient
Better
has
improvement.
improved. Okay, so there's okay.
And the patients will come more often.
So what's the benefit to the therapist if the patient comes more
So it's
often?
increased revenues and
Increased revenue. Here's another thing that if you can in any way find ways to increase the revenue of the physicians or the clinicians or whoever it is you're dealing with, that's a positive. Yeah.
So the channel is, thank you for the word, the Gillette consumable model,
Yeah.
where the device is free to the therapist and the patient pays extra sessions, and most of this money goes to the therapist, but some percentage goes to this company.
Okay. Yeah, and what you would do in a case like that, where you're giving it you're essentially saying the patient really is paying for your machine, as you said, for your device. But you've got, if you were to do financials and do a complete thing, you wouldn't show how quickly can the therapist or whoever's using it recover the initial cost of buying your product.
Yes.
And you could probably show it happen pretty
Yes. You want numbers or?
No, I have no doubt you have them.
Yes. So we identified 2 competitors, but it's a very new, one of the issues that we have is that this therapy is resistant to change, and it's a new market. And
How many are finding people that you're going out to talk to who are resistant to change? Oh, you haven't been out there long enough. There's a lot of resistance to change. I don't care who you're talking to, there is. That's not uncommon. How do you get around that?
Show the benefit, why they should change, what physical benefit they can see.
This goes back to what I said earlier about trying to find those first 10, 20, 30 customers who are the most painful. Because they will get it. They will serve sort of as your, they'll be your evangelists. Once you get, see, all you have to do is get a few of the right people on board, and you can leverage that for a long time to come into the next group, and the next group, and the next group, and it builds. Because, as you said, there's a lot of pushback. Many physicians are slow to change because they don't want to change how they've done things because it's worked quite well. And so until you can demonstrate that, wow, this clinic here is so up to date, they're doing all this stuff, and look at the results they're getting with their patients. And you can start to use that promotion to bring on more people. Good job on your segmentation, okay? And I would encourage you all to go for the big spreadsheet, but make sure you use the variables that are appropriate for what you're working on, because the more information you can get, the better. But it has to be in a form that you can make it useful. And I think this kind of a matrix with the going back to this, with these additional things in it, is going to be very valuable. Are there questions from anybody about your matrix, or is there anything you wanted to share? Yes.
I think the great part of that exercise, though, is if you're thinking about being an entrepreneur, is you have a core technology, but in order to get that customer, you might need some other small product or additional piece of information to bridge between what you got and what they need at facilities. So when you do that exercise, it helps you understand that it's some additional sales collateral, or if it's like some other small device that's your bridge, or something that's a training component of what it is.
Yeah.
Those are ways that you can explore that as an island to your technology by itself that may not be enough. There may be some little accessories that we need.
How many of you are developing products that could be considered a platform on which you can do lots of other things? Okay, then you are in a really happy place, because that's sort of kind of the gold standard of to get a platform so that you and then others can also develop on it, because that way you can hit more markets simultaneously with other people. You let other people develop. So that's part of, as you're doing your stakeholder analysis, you're looking for who are these people who can help me get into these markets, and thinking about that ahead so that you make the right choice initially. I wanted to move to, some critical things to remember, and then I want to talk for just a minute more about competitors. Total market size is not your market. Total market size is like, this is where the kind of the boundaries are. They're pretty amorphous and they're changing all the time. But this is where everybody's playing. And you have to define carefully where you're going to play. And it's always wise to play initially where you don't have any big bullies. Unless your strategy is to get acquired and move on. If that's a strategy, great, then you plan for that. And that's true with most pharmaceutical products. I mean, the strategy is not to go out and be a startup. The strategy is to go out and get acquired. So everyone with a problem doesn't need to solve it. keep that in mind. You know, as you press the importance of your product, make sure you're pressing it to the right people who actually have pain. New entrants in the market, which all of you are, should focus less on market share and more on how to reach customers. That's the key. How do you get to customers? And if you don't have a compelling problem, your solution doesn't matter, so market data will be wrong. Okay? Those are just kind of little things to remember. All right. On the other hand, if your product meets a significant need, you will have greater demand. You will be able to charge more for it, and you will have lower costs much more quickly. Okay? I don't ever recommend anybody going into the market saying, I'm going to be kind of a low-cost leader in this, unless you've come up with something just magnificent that is better, faster, and cheaper. That's disruptive, and that's a good thing. But don't go in with price as your focal point for what you're trying to accomplish. I think the big thing about competition is we don't know what we don't know, because most of what we'd like to know about our competitors is not something you can find on the internet. Unless you start digging deeply into seeing if they're having problems in any areas, or they've had, if you keep up with FDA and see who's been approved for things and who has not. My rule of thumb about competition is bad competition is the competition that's doing everything right. You don't want this competition. You do not want to go head to head with the company that is sort of the gold standard in the industry. Okay? Good competition is the competition whose customers aren't happy. You want to go after those. You want to take their customers, okay? Because you're offering something with a much better value proposition, and so they're more likely to change. I would also say, don't benchmark your competitors. What does that mean? What is benchmarking competitors? No? Yep.
Means trying to match them on their competency?
You try to match them on everything they're doing and saying, well, at a minimum, we have to do this. No. What defines what you do? What defines what you do? Is it your competitors? It's your customers. It's the problem you've identified, the value proposition you've identified. Okay? Now, I'm not telling you to be stupid about competitors. You know you have 3 types. You all know that? Direct. Direct competitors are people just like you. They're doing what you're doing. They're the same business model. Everything's kind of pretty much the same. These are the tough ones, because they may have similar products, different revenue drivers, and sometimes you don't recognize them, okay? Because sometimes they have resources you didn't realize they had, and they have that capability to quickly move into your space before you know what happened. So as you look at competitors, think out of the box about who has the potential to compete with me, not just who is the logical competitor. Okay? You can track the logical competitor, but these are harder. And then substitutes are just anything that could replace what you are trying to do. Is there a way to do what you're doing in a completely different way? How many of you have substitute products for your development? What's the substitute?
It's robotic devices.
Robotic devices, okay. How do you think you beat robotic devices?
They're expensive and require maintenance, and we provide a software solution to the client.
Okay, very cool. Robots means, equipment fails. Robots is inventory costs. Robots is, and you're doing a software solution, which is clean, Software has big margins. Good idea. Okay. All right. What does existing competition have that you don't? So the companies that are out competing with you right now for what you're planning on doing, is it forming a halo? It's blinding me. What does existing competition have that you don't?
Customers.
Yes, one thing, they have customers. What else do they have?
Marketing force.
They have marketing force. They know the landscape. What else? They can be entrenched. Yeah, the kind of, the inertia of success.
Maybe people recognize them.
They have brand recognition. That's huge. That is so huge. That's why I say find a niche. What else? What else do they have that you don't have? What? Money. Money. And if they're, if they're good-sized companies, they've got a lot of money to play with. So their R&D budget is something you've probably not seen, right? Anything else you can think of? I feel kind of stupid saying that. So much. They have market share, right? They have brand. They have professional management. Oh, that's huge. Huge. If I were going to predict the number one thing that could kill your project, it's the team you put together to make the business happen, assuming you're going to do a business. Okay? That's universally true. If you ever want to look at a company and it's having a problem, always look to management as the source of the problem. Proven products. They have proven products. They've already tested them. They're out there. I had a student come to my office this week, and he is developing a device to prevent people from falling, older people from falling. Now, so he came in, and they're so excited about this, and they've got a beginning prototype and all. I said, and so you've done your market research, you know what's out there. Yeah, and there's an Israeli company that is in the final stages of clinical trials, and they have patents. And I said, so how do you feel about that? Don't think it's going to be a problem because we're different. And I said, no, wait, because the reason he came to talk to me was he's thinking about not getting a job when he graduates in May. And he's going to go full-time in this startup venture. So he's saying, should he do this? Well, I can't answer that question for him, but I can answer the question about what are the red flags in what you found? Because they barely have a prototype. They haven't even begun to think about clinical trials or any kind of that. And we've got a company already coming out and one other company in Europe. So proven products that are ahead of you in the game have an edge. So you have to understand that edge and see if you can go around it, see if you can defeat it, see if you can still be successful. Successful product and customer knowledge. They have technology. Oh, this is huge. Supply chain. They got that. That's a big deal. When we developed our machine, it took us a year to source the 47 vendors for the components in our machine. Just to source them and to make sure we got the right suppliers and paid the right prices. It's not easy. It's hard. So existing companies have that. They have industry knowledge. So one of the things you can do that I think is kind of fun and it gives you a lot of information is draw a little sunflower, and there's your company, and then show the different market competitors that you have in different categories, the different market segments, and who's competing in that market with you. Okay? So that's an initial look. Where do you have the heaviest competition? Where does it seem like it's an easier one to get into? The other thing you can do with something like this is you can show how much has been invested in the companies in those markets. So if you're going into markets where there are a lot of young companies or mid-sized companies, you might be able to find out how much has been invested in those companies so that you know what your path has to kind of look like. Okay? Does that make sense? So it gives, again, it's a visual indication of what you need to do. All right, so we talked about the competitive matrix. There are some other things I listed here that are good to include in that matrix. This could be a gigantic engineering paper size one. Okay? I think I've given you a lot to think about. And I haven't given you everything there is to think about. And I didn't give you all of this to scare you or to have you think that, oh well, I'm done. I'm out of here. It's not that at all. I'm trying to give you a little bit of reality because you can do this. If it's hard, it's probably going to be better in the end. If it were easy, everybody would be doing it. And I have to say, and I say this in all sincerity, and Abs will validate this, I really like and appreciate people who do the hard stuff. Because I'm seeing too many people kind of defaulting to the, Instagram model. And I'm saying, here sits a group of people who are really doing the hard stuff. And every one of you has a chance to be successful. But nobody said it would be easy. And nobody said that somebody would clear the pathway for you and you just walk down it. But if you do, I think market research is one of the most important things that you can spend your time in. And I would encourage those of you who are not the interns, who are the PIs and that on the projects, I would encourage you to get out and talk to customers. Because you don't want to have everything, it's like being the president and having everything filtered when it comes to you. You want to go out and get the skinny yourself. You want to go out and hear from physicians and administrators and patients yourself too. So I know it's hard to do because you have your day job. But if you're really serious about moving this forward, I think you have to find a little time to do that. So do you have any final questions that I can
Go back to my initial comment on when to do this. It's so much easier for me to go and talk to a doctor and say, look, I have this regular toy, what do you think about it?
No. Thank you for saying that. That is not the question you want to say. Because, first of all, if you haven't been out to talk to them about what problems they're facing in doing the procedures, that's the first thing. Don't go out with this. Until you have something you can actually demonstrate for them, I wouldn't go out and do that. Because you'll probably get negative response. It won't be good response. You won't get the right response. So you really want to understand the problem. And you're the person who knows how to come up with a solution. So the more you understand the problem, the better your solution is going to be. Your customers are not solution providers. Your customers have no idea how to create a solution. Even if they're a clinician and they've used workarounds, they don't know how to do the best kind of solution. That's not their job. But those of you who are engineers and scientists who are creating the solutions, you do know how to do that. I can tell you all day my problems, but I wouldn't have the first notion of how to actually solve from an engineering perspective. Any other questions? Deer in the headlights. Yes.
Continuing to his question, you could have very different solutions to one problem.
Yes.
So you want to present that to the doctor to say which one you think is better.
Until you can actually, you can present the value proposition to the doctor, You know, what is more important to you to be able to accomplish this, or to have this result, or this result? But to go to a doctor without a fully developed prototype that they can actually experience.
Sometimes it's very expensive.
Of course it is. Yes, it is. It is. Until you have that, you've got to give them something that they can actually use before they can make a decision like that. I always say you never ask people what they'll pay for something, you know, and you never ask them if they'll buy. Because the secret is, if you understand their problem and you solved it, the question of buy is gone away. Okay? As long as you can price it as right, you know, according to what it needs to be priced.
But they need to solve it differently.
All right, if you're providing a customized solution, that's different. Then you understand, you know, you're not going to go out into the market probably hitting multiple customized solutions. You're probably going to find a grouping and go after them first and then start adding on. Because it would be too costly to modify your prototype every time. We did for our machine, we had components that were switchable on it. Now this was not a medical device, this was an industrial machine. But you could switch out according to what the customer wanted. If they wanted a certain kind of motor, we could plug, it was a plug and play kind of thing. And so that made it easy for us to be more customizable. So if you can design a plug and play kind of solution, then that brings your costs down. Yeah.
So that means first we need to show the value and then ask to pay for that?
If you show the value, they will be, I'm telling you, if you really show the value, they will be willing to pay, as long as what you're charging is within people's expectations for what that is. You can't ask them how much would you pay for this, because they will say as close to zero as possible. You know.
Somebody asked that question sometime, right? I mean, how does, or otherwise, how do you know how to price something?
Well, because later on, and you don't have to do this now, this is not something you worry about now, but you will be looking at other similar kinds of products that are manufactured in similar ways or whatever. Look at what the pricing is on those. Look at what products that solve the same problem you do, what are customers used to paying. But if you really create something of considerable new value, which ought to be the goal, you don't want to charge what the competitors are charging, because that doesn't reflect the value. So you can charge a little more, and the only question is how much more. So if I develop the cure for cancer, universal cure for cancer, okay, wave my wand, I can charge anything I want, literally, because people want it, okay? I wouldn't do that because you have to be realistic about, over the long term, how many people can you serve, at what price. But all technology comes down in price over time. Every technology becomes a commodity over time. So why would you go into the market at a low price when you're going to have to come down anyway? So you start at the highest price you can reasonably start at, recapture all your development costs as the price moves down. Does that make sense? Don't worry about pricing right now. Worry about customers and value proposition. And segmentation. And competitors. Well, if you get all that up front right, and you last class you spent on needs, critical, absolutely critical. You get all that part right, the rest falls into place. If you don't get this part right, you struggle through everything else.
Maybe I'll just add one thing, because for the audience, I want to grasp on something. So if you have something that's kind of a cost saver or cost avoidance or complication avoidance, some models say, well, what's the cost of not treating my product? Because we understand what my pricing. Devices don't have the pricing power that drugs do, but I think there's a very public story about treatment for hepatitis B or C, and the year treatment for this drug is like $80,000. So that's insane. It's like the insurance cash. your healthcare economics. If you don't use my drug, if you treat it with your other system, it's going to cost you $150,000. So even though I have a sticker price shock, the cost of using the other solution is so much higher that people did tolerate it. It's getting fair enough.
See, cost isn't just the initial price. Cost is the cost in use. So what is the lifetime cost for a patient of using this drug or using this device or whatever compared to what you're offering? Yeah, that's great.
It's just a good thing for people that, because it's hard to grasp on stuff like that. It helps you anchor or find some numbers, because I know we all struggle as engineers to find some numbers to look at this.
Yeah.
It's just one place to go help you have some foundation. It helps with the economic piece. As you say.
And if you're going to persuade people, whether it's persuading to get prototyping money or persuading to get somebody to partner with you or whatever, you have to show up at the table with evidence. You have to be able to prove everything you're saying in some manner. Okay? So you can't just come and say, this is going to be a big seller. Because there's no reason for me to believe you. Give me a reason to believe you. Okay? Don't assume that we'll just jump on bandwagon because we like you. We like you, but we want you to be successful. We want you to be successful, and I think, correct me if anybody disagrees, I would do you no service whatsoever if I just came in and said, have a good time, talk to a few customers, see where it leads you. That's not going to get you where you need to go and where you want to go. So I have told you the truth. Some of it's hard to take, but it's true. Okay? And I've learned from very hard experience. So yeah. Great.
Thank you so much.
You have been terrific.
So we have the room for an hour, and there's food and drink around the corner, and Kathy, I think, can stay. So if you have questions about your market and your competitive landscape analysis, take advantage. And the interns are here, and they can.
And VJ's here, and VJ can answer a lot of questions too.
And the
And
interns are here.
Elias.
And
Elias has gotten off the hook here a little.
So anyway, take
Elias,
advantage.
if you want good, solid truth, talk to Elias.
He is truthful.
Yeah, that's true. The problem is I usually don't like anybody.
He's tough. He's tougher than I am.
So anyway, so hopefully you can take advantage of the resources here, and